talk about micronutrient testing. I'm not sure if many of you understand what the meaning of that is. So I'm going to kind of do a broad view of micronutrients testing and like who's at risk. So your macronutrients are everything you get from your diet. So your carbohydrates, your proteins, and your fat. Right? And then your micronutrients are everything you get from those foods. So your vitamins, your minerals, your antioxidants, your essential fatty acids, your amino acids, all of those you actually get from your diet. I think people are, hold on, let me mute people. So in order to get those vitamins, we need to eat a balanced diet, and a balanced diet is going to be lots of fruits and vegetables and good fats and your proteins and your spices and your herbs. And it also is going to be important on how you cook those and what season you get those, right? So your vitamins and minerals are going to be more jam-packed when you're eating those fruits and vegetables, when they're in season, when they're local, there's not time, a lot of travel time, that type of stuff. Your meats, you're going to get more better of your amino acids, that type of stuff, if you're dry roasting or grilling your meats. Your vegetables, you want to lightly steam them in order to preserve the minerals that you get from your vegetables and your vitamins, versus eating canned or frozen or overcooking them, that type of stuff. So nutrient balance depends on a balanced diet and how you're cooking or buying your foods. It also depends on your GI tract. You need to have a healthy GI tract in order to absorb those nutrients from your diet. And so I thought this was kind of interesting, because I think most people don't understand that we're absorbing nutrients and different nutrients all through our intestines, which makes some people at a greater risk for absorbing their nutrients from their diet. For instance, people who have protein pump inhibitors, so they don't have enough stomach acid, or as we age, we produce less stomach acid. The stomach acid is what turns on your digestive enzymes. Your digestive enzymes are what break down your foods in order to get those nutrients out of them. And so some people are going to be at greater risk in this section, such as, your B vitamins and that type of stuff from your diet. People who have celiac or Crohn's or ulcerative colitis, right, where their large intestine is affected, might have some other vitamin deficiencies, vitamin K, biotin, sodium, chloride, potassium, that type of stuff. So our nutrient balance depends on our food. It depends on how well we absorb in our GI tract. And more important, and also what's very important that people don't realize, is then once you absorb it, those cells have to absorb it. So those vitamins need to get on those cells and get into the cells to do whatever their job is to do. And so we need to also look at cellular function. And I think that this is important because there's a lot of companies, like when you go to your doctor and you get your blood taken, they're going to be looking at whatever vitamin is flying down that vein right then and there, right? So it's looking at, yes, you've absorbed it, it's recently been in your diet, but it's not really telling me how well that you are assimilating those. So those vitamins are getting, or minerals are getting into the cells. And so I do like companies that do extracellular level and intracellular level. And that's going to be looking at your whole blood, your red blood cells, and your serum, and then also your white blood cells, which is going to tell me how well they're getting in. And why are nutrients important? They are essential for basically all functioning, for energy production, metabolism, your immune system, making your hormones, making your brain neurotransmitters, repairing cellular damage, which we all have, especially like in weather like this with really toxic air, right? We're all having a lot of oxidative damage. Bone health, did I say brain neurotransmitters? Heart conduction, fluid balance, that type of stuff. So your nutrients are important for everything. If I switch over to here, can you guys see the new chart, or do I need to re-share the screen? Can someone, yeah, it is. Someone's raising a hand. Oh, how cute.
We can see it. It's just kind of small.
Okay, perfect. Thank you. I will see if I can blow that up a little bit. I like these charts. I just found them this morning, actually, and I'll go over a little bit more detail. But these charts are a good way of like finding out not only looking at your vitamins and minerals, but what are the best food sources, what are the functions in the body, what are some of the deficiency symptoms, who's at risk, and that type of stuff. Because nutrients are so important for every function in the body, under that context, some of the symptoms where your nutrients could be off are pretty much anything under the sun. It could be poor night vision, dry scaly skin, abdominal discomfort, fatigue, nerve disorders, mental clarity, sugar crashes, fatigue after meals, obesity, stress, skin problems, arthritis, numbness and tingling, diabetes, autoimmune disorders, depression, anxiety, autism, ADHD. Like these are all of micronutrients should be considered in just about every condition as part of maybe a treatment process or why things might be off. So who are at the greatest risk? Well, like I mentioned before, people who have a decreased capacity to absorb, especially people as we age. And unfortunately, in aging in this circumstance is anyone over 50. So as we age, we have a decreased capacity to break down our foods and absorb those nutrients. We have a decrease in hydrochloric acid. The hydrochloric acid is what turns on your digestive enzymes. And we also have a decrease in bile. And so this is especially going to be true of vitamins that are protein bound. So we see a lot of common deficiencies among people that are 50 and older for B12, folic acid, iron, calcium, magnesium, potassium, zinc. As we age, our accumulation of toxins as well gets to be much larger, especially at times like this. And so when we're exposed to heavy metals, those heavy metals will preferentially bind to those cells. So again, we're talking about this intracellular balance. So those heavy metals will bind to the cells and kind of knock off those nutrients. Pesticides, mold, fertilizer, all those type of things can really deplete our natural antioxidants, especially stuff like glutathione. Again, going back to this chart, everything that's in green as far as vitamins are all your antioxidants. So we see depletion in vitamin A, vitamin C, vitamin E. No, that's not it. I got too many screens up now. Vitamin E, and I say A, C, E. So we see that. And then we also, if you think about that population, these people are also at greater risk for arrhythmias, cognitive decline, bone health, weakened bones, neuropathy. And so it's really imperative, I think, at certain populations to look at nutrient function or what their balance is. Many drugs also affect not only your nutrient balance, so they might deplete your nutrients, but vice versa. Some of those nutrients are going to mess with your medications. Maybe they decrease the effectiveness. This is really important if you are seeing your PCP. Do you guys see this new screen, by the way? Hopefully. To mention to your PCP that you're on vitamins. I ask my patients all the time what medications they're on, and they will always, list their, pharmaceuticals, but I have to keep asking, are you on anything else? Are you on over the counter? Oh yeah, I forgot, I take a B. Oh yeah, I take a vitamin D. So it's important to list those as well. And there are some medications that, that cause nutrient deficiencies that I think, really need to be considered. So oral contraceptives, for example, really deplete almost all of your B vitamins. And so we see a lot of women who are on oral contraceptives who will be complaining about depression or weight gain or fluid balance or energy and that type of stuff. So those are important drugs to consider. Antidepressants as well deplete our B vitamins. The sad thing about that is your B vitamins really help for mood stability. And so I think it's important to consider if you're on antidepressants that you might need to supplement I do want to say, and I was going to say it later, but I'm going to say it now too, that when you look through these charts and you look at some of the like deficiency symptoms and you identify with it, I think it's important that you bring that up with your primary care physician versus saying, okay, now I'm going to give vitamin A, because your nutrients, your vitamins, your minerals, they need to be in balance. Sometimes when we have excess of one mineral, we can deplete another. And so I wouldn't just like willy-nilly like, oh, they're just vitamins, so they're good for me. No, like you really should be careful, especially also considering if you're on other medications. The other one that I wanted to mention were protein pump inhibitors. Protein pump inhibitors by nature are decreasing your hydrochloric acid. So everything I mentioned before about breaking down your foods are at risk for deficiency. So we see a lot of people on protein pump inhibitors that have B12, especially deficiencies, but a lot of your Bs, calcium, that type of stuff. Aspirin, aspirin depletes your vitamin C. I know that we say a baby aspirin a day helps with your cardiovascular health, but so do your antioxidants. Vitamin C is really important antioxidant. Inflammation is at the heart of, and oxidative damage is at the heart of cardiovascular disease. So I think that's something to consider. And then also, of course, your cholesterol lowering medications. All your cholesterol lowering medications by nature are going to decrease your fat soluble vitamins. And so you're going to see deficiencies in A and D and E, and then of course CoQ10. So I think looking at your medications and the interactions with your nutrients are also important. Other people that are at risk are going to be pregnant women, breastfeeding, people who drink maybe excessive amount of alcohol, but also your adolescents, because of their nutrition is going to be varied and they need an increased demand. But the other one I really wanted to mention were athletes. Athletes are a big one. Not only do they have an increased need for energy production, but they also need more help in maintaining bone health, especially like runners, where we might see some, breakdown in bone, protect against oxidative damage, help with recovery, right? Those muscles need help with not only repairing from the activity, but maintaining and rebuilding. So athletes are really at a great risk for B vitamin deficiency. Your Bs are involved in energy production, making your red blood cells, tissue repair, that type of stuff. Bs can really help with endurance performance, strength, improvement in your cardiorespiratory function. Because athletes have an increased oxygen consumption, they are also at a great risk for oxidative damage. And so really antioxidants are really important with athletes, and omegas. Omegas, as we know, are really great anti-inflammatories. So they help with reducing pain. They also help give those nerves like a nice like protective sheath. And then they also help with lung capacity. So it's important for people who are athletes or just working out hard to consider their nutrient balance as well. I like to use Vibrant America. Vibrant America does the intracellular and extracellular. I also use Genova. One thing I do like about my Vibrant Americas is that, and here's a sample report. Can you guys all see that? Can someone let me know?
I can see
Yes, we can see it.
Perfect, thank you. So what I like is that they test your intracellular and your extracellular. So you get a report looking at, this one is comparing current with previous, but they're looking at your intracellular and your extracellular vitamins, and they'll immediately highlight what is low. What they'll also do, and they're looking not only at your vitamins and minerals, but also some of your amino acid metabolites, or your metabolites, your amino acids, and your antioxidants and your omegas, so your essential fatty acids. But the ones that you're deficient in, they'll then do, they make it very patient friendly, I think. They'll talk about what the function is of that vitamin or mineral or antioxidant or amino acid or whatever it was in the body, how it gets depleted, what are some of the manifestations of depletion, where are some of your food sources, and what are some of your supplement options. I do like that they really talk about, in addition to like some vitamins are synergistic with each other. So talking about what vitamins to take with each other, how to maybe you need to avoid taking certain ones with at times, that type of stuff. But then what I really like too is, let's say you are deficient in some, or maybe you're high, how does that put you at risk for, let's say, neurologic and cognitive function, liver detoxification, bone and joint health, cardiovascular health, that type of stuff. And so that's really nice too, because now we know, wow, with some of these vitamins that work, excuse me, synergistically for, let's say, cardiovascular health, if this person was low on potassium and vitamin K and magnesium, but they were higher in iron, like this is going to put them at a greater risk for cardiovascular disease. So I should really pay attention to that. And not only should I consider supplementing with these micronutrients, but also what can I do to improve their cardiovascular health? Maybe it's exercise, maybe it's stress reduction, maybe it's changing up their diet, maybe it's adding more powerful anti-inflammatories, that type of stuff. So I just wanted to give you kind of like a nice highlight. I know there's a lot of information, there's a lot of minerals, there's a lot of vitamins, but I think it is, I think it's important to, and you know, these charts are easy to find. I got this one on colonicbook.com. I just wanted something that was easily visual for you guys. But, you know, maybe start looking at what are some of the symptoms of deficiencies. Do any of you have any questions? Do you want me to leave the screen up? Does that help anybody? Oh, no, sorry.
Where did you get this again?
I got the charts from colonicbook.com. It was online. I can send you the link, Judy, if you like. Let's do. I think some people are allowed to talk. Any other questions?
Can you hear me?
Mm-hmm.
Okay, so my question is, I really like all this information and it rings true to me. It's stuff I've been studying, but I've been clueless to identify my own needs and weaknesses. So where can I get testing?
So testing, again, you could go through your primary care who will probably send you to lab and they will do some of the nutrients like, you know, B12, folic acid, vitamin D, what am I missing? Iron. Those are all things that you can get tested in a regular lab. And maybe that's a good first start. I am someone who really does like the more thorough testing through like Vibrant America, which is one I use. And if you'd like to use it, they are actually offering discounts for I don't know how long, but right now I think they're doing the test for the micronutrient test. For $250, it's normally like $5 something. I wrote some of them down, and then they're doing combination ones too, where you can do the micronutrient with food sensitivity panels, or micronutrient with neurotransmitters. So looking at your brain neurotransmitters. I like this because I did it on myself quite a few years ago. You know, I'm someone who can eat a block of cheese and thought that, you know, my calcium would have clearly been not a problem. And I ended up being pretty severely calcium deficient. You know, vitamin D, I've shown up low, but actually my intracellular was good. So I might need to supplement more, but I'm good at like getting it into my cells. So I just thought it was really interesting because it wasn't just so it wasn't so black and white. And for someone who knows a lot about micronutrients, I would have thought that most of these I was doing really good in my diet, and to find out I was deficient was interesting. You know, something like zinc, I think I was also deficient in. You know, I do eat a lot of seafood, I eat a lot of eggs, you know, so to me, it was weird that I was deficient in some of these. And that was looking at my intracellular. So I might have been getting it through my extracellular, it was in my blood, but my cells weren't absorbing it. And so I needed to supplement, and I needed to supplement at a higher dosing than, let's say, the RDA recommends.
Right. So I guess that's what I'm most interested in. How do I get those testings? Is there any chance any of those labs are covered by insurance?
So Vibrant America, it depends. Genova is another company that I use. They do bill insurance. They're much better at it. Vibrant America, we can attempt. Generally with Vibrant America, like with the special that they're doing, you kind of like, you get that special if you don't bill insurance. And so I think that would be something that if you want to contact me privately, either email me or you can call me. That might be better because I can point you in the right direction, because it's also going to depend on your insurance. Some insurances cover these much better. And sometimes insurance only covers certain amounts, certain vitamins, right? Like most companies will definitely cover potassium. That's in like a general comprehensive metabolic panel, but they're not going to cover manganese. And so I do think, you know, it would be something that we need to figure out depending on your insurance and how much information you want, if that answers your question.
Yeah, thank you very much.
No problem. Anybody else?
I had a question.
Mm-hmm.
So I know it probably depends if they're fat soluble or water soluble vitamins, but if you get a blood test, how much of that is a longer term look at your levels versus what you ate in the last 24 or 48 hours?
Most of us mean what you ate in the last 24, 48 hours.
Okay.
And that's why, because most of your testing is red blood cells. And so red blood cells are really looking at your extracellular level. So do you have it in your diet, basically?
Okay.
And I think that's, you know, really important for, like, let's say B12. A lot of people want to know if they're B12 deficient, and they'll get their blood tested and they'll look in, and the reference range too for most labs is so large. I mean, I think it's like 400 or 500 points or something like that. I can't remember. But that's going to really be reflective of what's currently in your diet. And, you know, your B vitamins, you urinate out. So they don't last that long in the body. But there's a huge part of the population who can't methylate their B vitamins, which I'm going to talk about, I think, next week, some of the genetic factors to absorbing and assimilating our nutrients, but they can't methylate. And so these people, you keep testing them and their B12 looks fine, you know, via regular labs, but really they are having a hard time assimilating them because they have difficulty methylating their Bs. So I do think it's important to kind of, if you're ever going to decide to do it, like, go for the true panel. Does that answer your question?
Yes, thank you.
Perfect. I like people being able to talk this time. It's more fun for me than questions. Although I hope I'm not missing any questions if people are typing. I think I have to stop sharing so I can see. Anybody have anything else? No? Thank you everyone for attending today. Please stay safe out there. You know, change your filters and do humidifiers. We've been steaming essential oils and trying to clean the air. sucks. I'm sorry. And if anyone has any questions, please email me or text me. And a copy of this will be on my website at drlindsaysnelson.com. Oh, I do have a new message. Why can't I see it? Oh, what oils do you recommend? Oh, for cleaning the air. Right now, I'm just throwing everything in. We're doing lemon and cedar and lavender and eucalypt. I mean, I'm just doing everything that I have at home, and I'm not sure one's better than the other, but it does seem to be helping a lot, actually. But I do think there's people online that are saying, you know, rosemary and thyme and that type of stuff. I'm not sure those are better. Sorry, I wish I had a better answer for you. What else was I saying? Oh, as far as if anyone did want to do some of this testing, it does require a blood draw. I am seeing patients in my home. So if you are interested, we can get that set up. I'll need an advance notice because there's a few vials that need to be drawn and frozen and mixed and all that type of stuff. So please, if you do want to get it done, give me a heads up and email me.
Hey, Lindsay, before we go, question. You know, I know everybody's talking about what are the long-term effects of this smoke. And I know you mentioned you might have a topic for next week, and school starts up next week. So I'm not probably going to be able to attend, but I know that that would probably be a topic
That'd be a good one.
I'd be interested in, is what are the long-term effects of everything in our environment right now?
Yeah, that's a great one. Thank you. I think I will do that. And yeah, just to let you know, I always put these on. So if you can't make it for the live, I always put them on my website shortly after.
Okay, I didn't know that. Good to know.
Yep. You can find all the past ones up there too.
Okay, so question, what is your website? I'm kind of new.
Doctor, so DR, and then my name, Lindsay, Lindsey, S is in Sam, and well, it's actually Sky, but Nelson, NELSON.com. So drlindsaysnelson.com.
Thank you.
And you can message me from there too. And my email is the same thing except at Gmail. So drlindsaysnelson@gmail.com. Anything else? All right. Thank you, everybody. I really appreciate you guys attending and asking so many great questions, and for a good tidbit for next week. Bye.